I've worked in emergency rooms for over 30 years, and I need you to hear me clearly. Most people over 60 will not survive their first heart attack if they're alone. That's not fear-mongering. It's fact. Nearly half of all heart attack deaths happen before the patient ever reaches the hospital. Why? Because people hesitate. They waste time. They panic. They don't know the simple, life-saving actions that can keep blood flowing long enough for help to arrive. And here's the harsh truth. If you don't know these steps, you could be gone within minutes. Every single day, I've seen patients wheeled into my ER who could have lived if they had done just one or two things differently at home. Crushing chest pain, shortness of breath, dizziness, cold sweat, and by the time they get to us, the golden window has already closed. But here's the good news. There are science-backed techniques, simple steps you can perform right now, even if you're completely alone, that can double your odds of survival. No myths, no gimmicks, just real, proven strategies that cardiologists teach their patients. In this video, I'll share 7 life-saving tips every senior needs to know to survive a heart attack when no one else is around. These are the same steps I wish every patient I treated had known before their attack. And wait until you hear number 3. It's incredibly powerful. Research shows it can mean the difference between lifelong damage and walking out of the hospital alive. Most people have never heard of it, but by the end of this video, you will. All studies and medical references are listed in the description below. Before we begin, I want to ask you something. How old are you? Let me know in the comments. I personally read and reply to as many as I can. It's like having a one-on-one chat in my clinic, so don't hold back. Now let's get started with number 7 on our list, the very first step that could determine whether you survive or not. Number 7. Call emergency services right away. Don't wait it out. The single most important action when you feel the symptoms of a heart attack is to call emergency services immediately. Don't wait. Don't second-guess yourself. Don't say maybe it's indigestion, or let's see if it passes. Every minute you delay, your heart muscle loses more oxygen. Cardiologists put it simply, time is muscle. The longer blood flow stays blocked, the more heart cells die, and the lower your chance of survival. According to the American Heart Association, people who call emergency services within 5 to 10 minutes of their first symptoms have survival odds up to 50% higher than those who wait. Yet sadly, many older adults hesitate. Research shows nearly 1/3 of people over 60 wait more than 2 hours before getting help, often because they don't want to bother anyone or believe they can tough it out. That hesitation can be fatal. Take the case of James, a 69-year-old retired teacher from Indiana. One night, he felt a strange heaviness in his chest. He brushed it off, thinking it was something he ate, and decided to rest instead of calling for help. Hours later, his wife found him unresponsive. Doctors told her he could have survived if he had called emergency services right away. Sadly, that story repeats thousands of times a year, and it's preventable. If you're over 60 and ever feel chest pressure, shortness of breath, nausea, or a sudden cold sweat, assume it's a heart attack until proven otherwise. Pick up the phone and call for help immediately. Even if it turns out to be nothing serious, you lose nothing. But if it is a heart attack, you've just taken the most important step towards saving your life. Acting fast is the first key to survival. While you're waiting for paramedics to arrive, what you do next can help keep your blood flowing and buy precious minutes. That brings us to tip number 6, a step proven to keep oxygen moving when every second matters. Number 6, chew an aspirin, don't swallow it whole. Once you've called emergency services, your next move can make a huge difference. Chew an aspirin unless you're allergic or your doctor has told you not to. Why chew it? Because aspirin isn't just a painkiller, it's one of the strongest clot-fighting drugs available without a prescription. Heart attacks happen when a clot blocks blood flow to your heart muscle. Aspirin thins the blood and prevents that clot from growing, allowing some blood to keep moving until help arrives. The evidence is clear. A landmark study in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23%. But speed is everything. Swallowing an aspirin whole takes 10 to 12 minutes to digest, while chewing it allows the medicine to enter your bloodstream in just a few minutes. When time equals heart muscle, those minutes can be life-saving. Take Robert, a 71-year-old former mail carrier. He was home alone when he felt crushing pressure in his chest. He remembered what his doctor had told him years earlier: chew an aspirin and call 911. He did both. Paramedics later said that simple decision likely kept blood flowing just enough to prevent major heart damage. He walked out of the hospital 10 days later, alive and grateful. Unfortunately, many seniors either don't keep aspirin at home or hesitate to take it because they're unsure it's safe. If you're not allergic and haven't been told otherwise by your doctor, keeping a small bottle of uncoated aspirin where you can reach it easily could save your life. Doctors usually recommend one full 325 milligram tablet chewed at the first sign of a heart attack. Think of it this way: chewing that one pill is like sending a rescue team to slow down the disaster until professional help arrives. It doesn't stop the heart attack, but it can prevent the worst from happening. But surviving a heart attack alone isn't just about medication. It's also about what you do with your body in those critical minutes. That brings us to number 5, a simple but powerful adjustment that helps take the strain off your heart. Number 5, loosen tight clothing and sit upright. When a heart attack begins, every move you make affects how hard your heart has to work. One of the simplest yet most overlooked survival actions is to loosen any tight clothing and sit upright. Seniors often underestimate how restrictive clothing or posture can increase the heart's workload. Tight belts, collars, or waistbands can make it harder for blood to circulate when your body is already under stress. Sitting upright helps your lungs expand and takes pressure off the diaphragm, allowing easier breathing. Lying flat, on the other hand, can force your heart to pump harder, especially if you have lung issues or heart failure. The European Heart Journal reports that upright positioning helps reduce fluid buildup in the lungs and lowers chest pressure, giving your heart a fighting chance. Take Linda, a 75-year-old woman from Florida. She was watering her garden when she suddenly felt chest pain and shortness of breath. Instead of lying down in panic, she walked slowly to her porch chair, loosened her gardening apron, and sat upright while calling for help. Her doctor later told her that choice likely prevented her from fainting before paramedics arrived. It's such a simple move, but it matters. If you ever feel pressure in your chest, loosen your clothes, sit upright with your back supported, and take slow breaths. Think of it as giving your heart more room to breathe. Those few actions can make all the difference while waiting for help to arrive. And to further improve your odds, you'll need to keep oxygen flowing to your brain and heart while under attack. That brings us to tip number 4, a powerful move you can do right now that could save your life when no one else is around. Number 4, cough strongly if you feel faint. It can keep blood flowing to the brain temporarily. It may sound unusual, almost too simple, but during a heart attack, coughing, yes coughing, can sometimes keep you alive until help arrives. Doctors refer to this as cough CPR. The idea is straightforward. When you cough deeply and forcefully, your chest muscles tighten, your diaphragm contracts, and pressure builds inside your chest. That pressure pushes blood out of your heart and up toward your brain, keeping you conscious when circulation begins to fail. Let's be clear, cough CPR is not a replacement for medical treatment, and it's definitely not a cure for a heart attack. But it can buy you valuable seconds if you start feeling dizzy, lightheaded, or like you're about to lose consciousness before paramedics get to you. Research published in the Journal of the American College of Cardiology found that strong, repeated coughing during certain cardiac arrhythmias kept patients awake and maintained their blood pressure long enough for treatment. In several cases, people remained alert for minutes simply by coughing every 2 or 3 seconds. Take the story of Tom, a 68-year-old retired electrician from Oklahoma. He was alone in his garage when he suddenly felt his vision blur and a crushing pain in his chest. Remembering what he'd once heard about cough CPR, He began coughing hard, again and again, and managed to stay conscious until the ambulance arrived. Doctors later told him those forceful coughs may have prevented him from collapsing and suffering brain damage before they could stabilize his heart. Here's what happens physiologically. Fainting during a heart attack is caused by an abrupt drop in blood flow to the brain. When you cough hard, you create a momentary surge of pressure, almost like artificial heartbeats, that help push blood upward. It won't stop the attack, but it can sustain oxygen flow to the brain long enough to keep you awake until help takes over. If you ever feel your vision narrowing, your head spinning, or your body growing weak during chest pain, try this. Take a deep breath, then cough hard and deep as if you're trying to clear your lungs. Repeat every 2 to 3 seconds until you feel stable or help arrives. Think of it as manually keeping your heart moving when it's struggling. It may sound odd, but this simple technique has saved countless lives. But once you've stabilized yourself, you must make sure oxygen is still getting to your lungs effectively. That's where tip number 3 comes in, another small habit that can make a huge difference. Before we continue, if you're finding value in this information, tap that like button and subscribe. Turn on notifications so you never miss powerful health tips that could save your life. Number 3. Unlock your door and keep your phone nearby, so help can reach you quickly. When a heart attack strikes, every second matters, not just for your heart, but for the rescuers racing to save you. One of the simplest yet most overlooked survival steps is to unlock your door and keep your phone within reach. It might seem minor, but in a crisis, it can decide whether help reaches you in time or not. Here's why this matters. Emergency responders are trained to break down doors if they must, but even that takes time, and time during a heart attack is everything. Studies show that for every 10 minutes of delay in treatment, survival odds drop by nearly 10%. Imagine losing those life-saving minutes simply because rescuers can't reach you. Unlocking your door removes that obstacle before it becomes fatal. Consider Mr. Jenkins, a 74-year-old widower from New Mexico. One evening he felt chest pain and called 911, but collapsed before unlocking his front door. Paramedics arrived quickly but lost valuable minutes forcing entry. Tragically, he didn't make it. In contrast, Ms. Parker, an 82-year-old woman from Georgia, unlocked her door, kept her phone in hand, and sat by the entryway while waiting for the ambulance. Paramedics got in instantly and began treatment right away. She survived with minimal heart damage. The second part of this tip is just as vital. Keep your phone close at all times, especially if you live alone. Many older adults leave their phone charging in another room, which can be deadly in an emergency. During a heart attack, even walking a few steps can cause collapse. Keep your phone next to you, and if you call emergency services, put it on speaker so you can follow instructions without holding it. Your phone is your lifeline, and an unlocked door is your bridge to help. Together, they eliminate barriers and buy back the time your heart desperately needs. Once you've cleared the way for help, the next focus is on keeping your body calm and oxygen levels stable. That's where tip number 2 makes all the difference. Number 2, take slow, deep breaths, lowers stress on the heart, and improves oxygen flow. In the middle of a heart attack, panic is your biggest enemy. When fear hits, your body releases a surge of adrenaline, the fight-or-flight hormone, that makes your heart beat faster and harder. But that extra workload can make things worse. One of the most powerful tools you have in that moment is your breath. Taking slow, deep breaths does 2 crucial things. It increases the amount of oxygen reaching your bloodstream and brain, and it signals your nervous system to relax, easing the strain on your heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention showed that controlled breathing helped lower heart rate and stabilize oxygen flow, even in patients with severe heart disease. It doesn't stop the attack, but it gives your heart a better chance of surviving. Margaret, a 75-year-old retired teacher from Illinois, told me how she got through her heart attack by focusing only on her breathing. As her chest tightened and her pulse raced, She sat upright, closed her eyes, and inhaled slowly through her nose, exhaling through her mouth even slower. When paramedics arrived, she was weak but still awake. Her cardiologist later said her steady breathing helped prevent her blood pressure from crashing and gave her heart a chance to recover. Here's how to do it properly. Place one hand on your stomach, not your chest. Breathe in slowly through your nose until you feel your belly rise. Then exhale gently through pursed lips, like you're blowing out a candle. Try to take 6 to 8 breaths per minute, steady, calm, deliberate. This kind of breathing gives your heart oxygen and keeps panic under control when it matters most. Each breath buys you more time. Time for oxygen to reach your brain, time for your heart to catch up, and time for paramedics to reach you. And finally, we reach the most important step of all, the single action that ties everything together and can truly decide your fate in those crucial moments. Number 1. Stay as calm and still as possible. Movement can worsen damage. During a heart attack, when a heart attack begins, your natural instinct might be to move around, to pace, or even to walk it off. But that reaction can be deadly. The number 1 rule for survival is simple. Stay calm and still. Every sudden movement makes your weakened heart work harder, using up oxygen it can't afford to lose. During a heart attack, blood flow through your coronary arteries is blocked or severely limited. Moving increases your heart's demand for oxygen, but since supply is already cut off, that extra effort only worsens the damage. A study published in the European Heart Journal confirmed that patients who minimized exertion during acute heart episodes had fewer complications and better outcomes. Harold, a 70-year-old farmer from Kansas, felt crushing chest pain while working in his barn. His instinct was to climb a ladder to grab his phone, but he forced himself to stay still and call for help from the ground instead. Paramedics later told him that staying calm and avoiding exertion prevented his heart from collapsing under stress. He survived with minimal damage. Panic doesn't just affect the body, it also hijacks your mind. When adrenaline surges, blood pressure rises, and the heart's rhythm becomes even more unstable. That's why calmness isn't optional. It's essential. Combine stillness with deep breathing and focus only on one thought. Help is on the way. My job now is to stay still and breathe. Avoid trying to get up, grab items, or move toward the door. Every step risks collapse before help arrives. Think of your heart as a fragile engine running low on fuel. Every unnecessary movement revs the motor and could blow it apart. Stillness conserves your strength and keeps blood flow stable. So remember, do less, breathe more, and trust that every calm second you create is one step closer to survival. Together, these 7 steps form a clear survival roadmap. You can't always predict when a heart attack will strike, but knowing exactly how to act can make all the difference. From calling emergency services immediately to chewing aspirin, loosening tight clothes, coughing when faint, unlocking your door, breathing deeply, and finally staying calm and still, each action buys you time. And in a heart attack, time is everything. A heart attack rarely gives second chances, but with knowledge, readiness, and calm action, you can dramatically increase your odds of living to see tomorrow. Now, I'd love to hear from you. Where are you watching from? Do you keep a Spirin or an emergency plan at home? Share in the comments below. I read every single one because your story could save someone else's life. Don't forget to like this video, share it with family, and subscribe for more life-saving health tips. Stay safe, stay prepared, and remember, knowledge is power, especially after 60. Thanks for watching, and take good care of your heart.